Today we're speaking with Dr. Peter Libby, cardiologist at Harvard Medical School. Dr. Libby, welcome. I have some interesting stuff here to go over with you, if I may. First of all, let's talk about the conference. As I'm sure you know, when you go to different scientific conferences, in your case, it tends to be focused on a particular organ, usually the heart, or a particular specialty. But this Vatican conference brings people together from a variety of different disciplines. What's the value of that?
Well, I think it's incredibly valuable. You know, we're in a time when we're getting more and more subdivided professionally. Mm-hmm. We have specialties, we have subspecialties, we have subspecialties, and we all are in our own little beehive working alone. And it's wonderful to have a structured opportunity to have a meeting of the minds where we can broaden our perspective and really get away from that quotidian concern of our own little microclimate and really think about global problems with a much broader perspective.
And not just in the science, but in morality, ethics, all sorts of areas, it seems that we can, and that are being involved in this particular conference.
I think the broader our exposure, the more time we have to interact with others with different pieces to offer, I think the more human we become, and we could solve a lot of human problems if we had open ears and open eyes, and we're able to really embrace multiple disciplines and multiple cultures. So the Cura meetings are really a fantastic vehicle for promoting that kind of global perspective.
Exactly. We've been talking a little bit about music and music's effect on people. And I think we all can identify with music transporting us to a different time, making us feel better, reminding us of different things. But can music actually have an impact in your field on cardiovascular disease?
Well, there's an emerging science of the connection between music and the cardiovascular system. Obviously, we have this as a common experience that we know that we have personal enjoyment from music that can help relax us. We know that the autonomic nervous system is affected by music. So the autonomic nervous system is one side is the fight or flight response, which gets us all hot and bothered and our heart rate up. We call that sympathetic. And then there's the opposite side, the parasympathetic system, which is more calming. We call it the juicy side of autonomics. And it turns out that music actually can change the balance between these two opposing sides of our autonomous nervous system. And we're now emerging into a different era when we can actually do more modern physiology of looking at the methods that control our circulation in relation to music. And we heard about that from Jacqueline in part of our program. And then we have the advent of functional magnetic resonance imaging of the brain, where we can see that different types of music light up different parts of the brain. For me, that's in a very descriptive state, but it shows that we have some tools now that we can harness to really be rigorous about understanding how it is that music affects physiology, including that of the cardiovascular system.
And speaking of which, I'd be remiss if I didn't ask you a question about inflammation, because that's clearly an area that you're a world leader in. Can music have an impact or an effect also on inflammation? Because now we know that runaway inflammation is almost the basis of so many disease processes.
That's a fantastic research question, and I'd love to see rigorous studies of music interventions and biomarkers. And I think those could be byproducts of some of the studies that are underway, for example, with heart failure patients. But I think today, for the public, the interventions that can probably give us the best benefit in terms of an anti-inflammatory effect would be physical activity. Do whatever you can, do it regularly, and that can help us. And then a healthy diet, I think, is another way to try to quell inflammation and reap the health benefits.
Somehow it keeps coming back to diet and exercise, doesn't it?
And it's more weight control than it is the particular composition of the diet. And it's more the pattern of a diet rather than a specific macro or micronutrient. So we're learning. And I think that the public will benefit from the renewed interest in this art and health interaction.
Dr. Peter Libby, thank you so much for being with us. Interesting information, and hopefully some of that we'll take to heart, if you should pardon the pun. Thank you for being with us.
Okay, thanks for inviting me.
You bet.